Our patients deserve so much better, and by providing them medical care, by providing them psychiatric care, by providing them case management care, we're able to meet their needs and help walk with them on their journey and help move them forward in their life in a way that may not be possible without a program like Boston Healthcare for the Homeless program.
We're taking care of who needs to be taken care of. The folks that most people will look over, the folks that people will walk right by on the street and not give a second thought to. We want to make a difference. I think everyone who works here, from finance to the nurses to the aides and the cleaners, everyone here really is trying to make a difference.
I think what keeps most of us going is as we get to know people and learn their stories, you get captured. They become real heroes in our lives, people who have been dealt the worst hand you can imagine, but who play that hand with great courage, great creativity against all odds.
A lot of the people who are here, who work here, can see past just the challenges that people have and see past their own needs and have hearts big enough to help others.
I am very much familiar with the challenges that our patients go through. I grew up observing a lot of this, whether it's substance use, homelessness, accessing resources in the community. None of this is new to me. So for me, my motivation is ensuring that people are getting quality care and accessing the services accordingly. I am a Bostonian. This is my community. So every day that I am engaging with the patients, every day that I am able to see someone smile, those are my rewards.
It's the small victories that make everything worth it. So it can be a really rough day. We could have responded to a number of overdoses, and it's that one patient who I haven't seen in months that walks into the clinic, and just seeing them makes it all worth it.
I can't say enough good things about the place. It's what it's done to me, the people around me. It really has changed my life.
I really needed their help, and they helped me out a lot. They have.
I see patients on the street, in church basements, in clinic, at home, in hospital settings, and it's a beautiful part of BHCHP's model that we're able to do that. And I feel like every interaction with a patient is kind of like a stroke of the paintbrush, and over time you're painting your mural, and that mural becomes more clear. And being able to see patients in these various settings, you really gain such a deeper understanding of them as you would just behind the walls of a doctor's office in a more traditional clinic setting.
We are doing really such cutting edge work for folks who really have fractured lives. And we are often that stabilizing force. Having emerging leaders I think it challenges us to figure out how to always be better.
The Emerging Leaders Board is made up of different young professionals in business, in pharma, in education, medicine. So it's really kind of just people who are interested in working with this population and being involved with the organization. I think what I've enjoyed most about my experience on the board, the Emerging Leaders Board, is first, being able to work directly with the clients that BHCHP serves again, but I think also just teaching the community about the organization and how much of an impact it really makes, and how to become involved and participate if they choose to do so.
At Boston Healthcare for the Homeless program, we have an AmeriCorps program. It's a great opportunity for people who are interested in healthcare to work with people experiencing homelessness. So it's a great opportunity for anybody who has those kinds of interests, like me.
One of our real goals has been in the program is how do you set up an environment where young and dynamic and really highly trained doctors, nurses, social workers, recovery coaches can really embrace this work as a life project.
People are driven by where their heart leads them, and they're trying to get everybody to equity and everyone to a place where they can be recognized and become a part of society again and community. I think everybody wants community for everyone. And as long as there are people out here who don't have that sense of community or belonging, there will be people who are here at Boston Healthcare for the Homeless who want to make sure that that happens.
Life's too short to not do work that you love and that feels fulfilling to you. And for me, this is very fulfilling work.